All right, everybody, buckle up. Because today we are diving headfirst into the world of dialysis for chronic kidney failure.
It's a treatment, that millions depend on. And we're really lucky to have this super in-depth review article from JAMA just came out October 2nd.
Talk about good timing. And seriously, this article is dense, folks, packed
Yeah.
with info, so let's not waste any time. Um, for those who might not be familiar, what exactly are we talking about when we say chronic kidney failure?
So picture this. Your kidneys, they're like these amazing filters, right? Constantly working to clean your blood, removing waste and extra fluid. Chronic kidney failure is what happens when those filters, well, they just can't keep up anymore.
And we're talking way beyond, like, needing to cut back on the soda.
Right. Oh, yeah. This is serious business. It's all about how well your kidneys are filtering, measured by this thing called the glomerular filtration rate, GFR for short. When that number dips too low, it's a sign that things aren't working the way they should.
And that's where dialysis steps in to lend a hand, or a filter, I guess you could say.
Exactly. It takes on that vital job of cleaning the blood, using technology to essentially replace, or at least assist, a critical bodily function.
And our listeners might already know that is no easy feat. The article dives into two main types of dialysis: hemodialysis and peritoneal dialysis. I'll be honest, before this deep dive, I kind of thought they were basically the same thing, just like slightly different methods.
I can see why you'd think that, but they're really quite different approaches, each with a whole set of considerations for the patient. It's almost like choosing a lifestyle, in a way.
Okay, now you've got me intrigued. So before we unpack each one, could you give us the quick rundown, just a taste of what we're about to explore?
Absolutely. In the simplest terms, hemodialysis is like outsourcing the filtration. Your blood is literally drawn out and cleaned by a machine, usually at a dialysis center, several times a week.
And peritoneal dialysis, that's where it gets really wild, right? Like something out of science fiction. Using your own body in this whole other way.
Right. You're using the lining of your abdomen, it's called the peritoneal membrane, as the filter itself. It involves this special solution, and honestly, it's a fascinating blend of your body's natural processes and medical technology working together.
You're telling me it's not every day you hear about your own insides becoming part of the treatment. But before we get too far ahead, we should probably acknowledge that chronic kidney failure, it's serious, right? The article doesn't shy away from that.
Absolutely. It's important to be upfront about the realities. This isn't just a bump in the road, it's a major health issue, and it needs lifelong management. Plus, it comes with its own set of potential complications.
And that's why we're here, to give our listeners the information they need to make sense of it all.
I couldn't agree more. Knowledge is power, especially when it comes to healthcare decisions.
So, with that in mind, let's roll up our sleeves, dig into the nitty-gritty of each type of dialysis. First up, the one that might sound like something out of a sci-fi movie? Hemodialysis. Okay, hemodialysis. I have to admit, it does sound a little intimidating. Like, picture your blood going on a little field trip to get filtered. How does that even work in real life?
Well, you're not wrong. It does sound kind of sci-fi, but the idea behind it is actually pretty straightforward. Basically, your blood is drawn out of your body, and then it's passed through this super specialized filter. It's called a dialyzer.
A dialyzer. Okay, so that's doing the heavy lifting, the cleaning that your kidneys can't handle anymore.
Exactly. Removing those waste products, getting rid of excess fluid, the whole 9 yards, and then once it's all cleaned up, that filtered blood gets pumped right back to you.
Like a car wash, but for your blood. Okay, that makes sense. But to pull that off, you need a way to, like, access the bloodstream regularly, right? I think this is where those vascular access points come in. And honestly, the thought of it always makes me squirm a little.
Yeah, I get it. Needles aren't everyone's favorite. But trust me, these access points are crucial. The article talks about 3 main types: AV fistulas, grafts, and catheters. Each one has its own pros and cons, things like how long they last, how likely they are to get infected, and just generally how comfortable they are for the patient.
And the article really seemed to stress that AV fistulas are the gold standard here. What makes them so special?
Well, for starters, an AV fistula, it's created by surgically connecting an artery and a vein, usually in your arm. This creates a much bigger, stronger blood vessel, and it can really handle those repeated needle insertions that you need for hemodialysis. Plus, they tend to have a way lower risk of complications.
So if you know you're going to need hemodialysis down the line, getting that fistula sorted out early is key.
Absolutely, like laying the groundwork for successful treatment. Now, grafts, they're kind of similar because they also connect an artery and a vein, but instead of using your own blood vessels, they use this synthetic tube that gets implanted under your skin. It's a good option if, for some reason, a fistula isn't possible.
And then there's catheters, which the article mentioned are sometimes used, but I seem to remember those come with a higher risk of infection.
You remember correctly. It's basically like having a more direct, open route into your bloodstream. So while they're definitely necessary sometimes, they need a lot of extra care to stop bacteria from getting in and causing trouble.
So it's a trade-off, right? Convenience versus risk. Speaking of which, where does the actual hemodialysis happen? Is it always at a hospital?
Not always, but most often it's done at a specialized clinic a few times a week. These sessions can be pretty lengthy, sometimes lasting for several hours at a time.
Wow, I didn't realize it was that much of a time commitment. It's like a part-time job almost.
It can definitely feel that way, which is a big reason why home hemodialysis is becoming more popular.
Home hemodialysis. I'm picturing a giant humming machine taking up half the living room.
Huh. Not quite that dramatic. Home hemodialysis machines, they've gotten a lot smaller and more manageable. And patients are actually trained to operate them themselves, sometimes with help from a family member or a caregiver.
Wow, so you're bringing the treatment home, literally.
Yes.
That's incredible. But logistically, how does that work? Do you still have to do it just as often as in-center hemodialysis?
That's the cool part. Home hemodialysis, it often involves shorter but more frequent treatments, sometimes even daily. This actually gives patients a lot more flexibility and control over their schedules. Plus, some studies are even suggesting that it could be more effective, at least for certain people.
So not one size fits all. It's about figuring out what works for each person's needs. But I'm guessing there are downsides to the home approach too, right?
Sure, there can be. For one, you need the space at home and the resources to accommodate the machine and all the supplies. And even though the treatments are shorter, it's still a big commitment to self-care, sticking to a strict schedule. And it's not for everybody. Some people find the responsibility a bit overwhelming, but others, they really thrive on the independence it offers.
Sounds like no matter which way you slice it, having a strong support system is key. Both the medical support and the personal support too.
Couldn't agree more. You need a good team of healthcare providers who really listen to your concerns and work with you to figure out the best plan. And of course, having loved ones to provide emotional support, practical help, just someone to be there for you. That can make a world of difference.
This has been so eye-opening, really. I had no idea there were so many angles to consider with hemodialysis, but now I'm even more curious about peritoneal dialysis. Using your own body's filtering system sounds both amazing and a bit like something out of a movie.
I know, right? It's a totally different way of thinking about dialysis. And it's been around for a while, and for some people, it's a real game changer.
Peritoneal dialysis. It's like the quieter, gentler side of dialysis, isn't it? No fancy machines, just you and your own body doing what it does best.
It really is remarkable when you think about it. It really showcases the power of the human body.
Okay, so walk me through it. How does this actually work? You mentioned the peritoneal membrane before, which, full disclosure, I had to look up again to refresh my memory.
It's a pretty incredible structure. The peritoneal membrane, it's this thin lining, but it's surprisingly tough. And it surrounds all your abdominal organs, kind of like a protective barrier. But it can also act as a filter, which is where the magic happens.
So instead of sending your blood off on a cleaning spree through a machine, this type of dialysis actually uses that built-in filtration system. But how do they even make that happen? Does it involve, like, some super complicated medical procedure?
It might surprise you, but it's actually pretty straightforward. It all starts with a small surgery to put a catheter into your abdomen. That catheter, it's basically a small pathway, to access the peritoneal cavity, which is where all your abdominal organs live.
Right, right. So the catheter's like the doorway to the filtration zone. What happens next?
That's where the dialysate comes in. It's the specially made solution, totally sterile, and it's designed to draw out those waste products, and that excess fluid across the peritoneal membrane, kind of like a sponge, soaking everything up.
Okay, that makes sense. So they put this dialysate into the abdomen through the catheter, and then what? It's like magic.
Well, not magic exactly, but it's pretty darn close. The dialysate hangs out in that peritoneal cavity for a few hours, long enough for the waste and extra fluid to move from the bloodstream across that membrane and into the dialysate itself. Then that used solution, it gets drained out and they put in fresh fluid. It's this ongoing exchange.
Wow, so it's like your abdomen becomes its own self-cleaning filtration system. I read that there are a couple of different ways to actually do those exchanges, right? Something about CAPD and APD.
Exactly. Those are the two main types of peritoneal dialysis. ZIPD stands for Continuous Ambulatory Peritoneal Dialysis, and then APD is Automated Peritoneal Dialysis. And the difference is all about how they manage those exchanges, the draining and refilling.
So CAPD, is that the one that's more hands-on?
You got it. With CAPD, you're manually draining and then refilling the dialysate several times each day. It's definitely more involved, but it gives you a lot of flexibility since you're not hooked up to a machine.
And with APD, it's more of a set it and forget it kind of thing.
Pretty much. For APD, you use this machine called a cycler, and it does everything for you, usually overnight while you sleep. It cycles through the draining and refilling, so you wake up with fresh dialysate.
Okay, I have to say, that does sound pretty appealing. But I'm guessing, like with everything else, each type comes with its own pluses and minuses, right? How do you even begin to choose which one is the best fit for you?
That's definitely a conversation to have with your healthcare team. They'll help you weigh the factors. Things like your lifestyle, how much independence you want, even your living situation could play a role. Some people love that CIPD gives them freedom, while others prefer the convenience of APD.
It really highlights that there isn't a one-size-fits-all solution when it comes to dialysis, doesn't it?
Not at all. It's all about figuring out what works for each individual person and their unique needs and circumstances. And that goes beyond just deciding between hemodialysis and peritoneal dialysis. Even within each type, there are so many different things to think about. Treatment schedules, medications, lifestyle changes. It's a real balancing act to manage this complex condition while also having the best quality of life possible.
And that's where having a supportive healthcare team by your side and being able to talk openly about everything really makes all the difference.
Well, we've covered so much ground today. I mean, we've gone from the inner workings of our kidneys to the amazing science behind dialysis treatments. But as always, folks, this is just the beginning, right?
Exactly. We've just scratched the surface here. There's a whole world of information out there, and hopefully this deep dive has given you the tools and the confidence to keep exploring. Because the more you know, the better equipped you are to make those important decisions about your health. So keep that curiosity alive, don't be afraid to ask questions, and never stop learning. Until next time, happy diving.